All right, good afternoon, everyone, and thanks so much to our citizens and to our media members and our continued dialogue on COVID-19 and its impact directly here in Orange County. For our press briefing today, we have Orange County Mayor Jerry Demings, the City of Orlando Mayor Buddy Dyer, Dr. Yolanda Martinez, Director of Orange County Health Services Department, Dr. Raul Pino, Health Services Officer for the Florida Department of Health in Orange County. Sheriff John Mina is here. Dr. Barbara Jenkins, the Superintendent of Orange County Public Schools, and Chief Judge Don Myers from the 9th Judicial Circuit Court. We'll start first with our Orange County Mayor, Jerry Demings. Mayor.
All right, thank you, Dr. Williamson, and good afternoon to all of you. In addition to those who are participating on the program, we also are joined by Orange County Commissioner Moore, who is here with us. We've come to the end of another week, and there's certainly been a lot of breaking news developments that have occurred here within our community as we grapple with the most effective way to stop the spread of this deadly disease within our community. At 12:01 a.m. today, the governor's stay-at-home order went into effect. It is critical that we continue to follow the CDC guidelines and adhere to this new statewide order. It will help create a unified front to get us through this pandemic. The governor's directive overrides the Orange County stay-at-home order. However, this does not mean that the curfew is not in effect. The curfew here in Orange County remains in effect from 11 p.m. to 5 a.m. nightly. Orange County is now approaching nearly 600 positive cases of the coronavirus within our community. To put that into perspective, again, we go back to that date, March the 14th. We had one case in Orange County. Here we are today, before the end of the day, at 600 plus cases. We have updated our heat maps, as you can see here, and we'll be posting them for our residents and on our websites as we continue to update them. The following zip codes are in the hot zones with anywhere from 21 to 30 coronavirus cases within the zip code: 32803, 32822, 32824, 32825, 32828, 32837, and 34787. Now, if your area does not look like a hot zone today, it can tomorrow, if you don't heed the social distancing orders or directives that we're putting in place. Don't be misled about the lack of numbers in your community. According to the CDC, as many as 25% of us can be infected with the COVID-19 virus but not show any symptoms. Dr. Pino will follow up on these numbers in just a moment. Once again today, we have seen a continued increase in the number of positive COVID-19 cases within Orange County, and we are preparing for the surge or peak unique to our area. In preparation for the peak, Mayor Dyer and I held a meeting with the CEOs of the region's largest hospitals and medical experts from their staffs to discuss hospital capacity now and during the surge. We should be reassured that our hospitals are planning appropriately and have created their own predictive models and review other models from throughout the country, from noted institutions like Harvard, Cornell University, Penn State, and the Institute of Health Metrics and Evaluation. These models have taken into consideration data from metropolitan communities that have already experienced surges. Our healthcare systems or hospitals are evaluating key variables such as population infection rate, hospitalization rates of those infected, intensive care unit admittance, the need for equipment such as ventilators, and the number of available hospital beds and related healthcare staffing. From today's conversation, we agreed that our approach to managing the surge will require a multi-county focus because that is how our healthcare networks function within this market or region. I have reached out to our neighboring counties to continue the dialogue on what works best for all of us. The data analytics indicated that the rate of new cases had been doubling in our area every 3 days prior to the implementation of the social distancing orders within our community. Now, the most recent modeling indicates that every 3.8 days we see a doubling of the numbers of reported COVID-19 cases. In other words, if we can impact the change, for example, where the numbers only double every 4 to 6 days, that means that we have effectively slowed the spread of the virus in our community. So that's our goal, is to increase the period of time it takes for the new cases to double. So it appears that any actions that mandate social distancing or restrictions of movement by human beings is the best strategy to reduce the spread of the virus in our community. I've tasked the Orange County Medical Director, Dr. Christian Zuber, to work with the hospitals to develop consistent protocols in how we engage with sick individuals, from the 911 call and response by EMS, fire and law enforcement, first responders, pre-hospital, right up to transport and entry into the hospitals. It will be key for us to then coordinate with the state and FEMA to ensure that we have the necessary equipment, medicines, and facilities to respond more cohesively across local jurisdictions. With the spread of the disease still on the rise, it is apparent to everyone in Central Florida that COVID-19 has affected every aspect of our lives and within our communities. From workers losing their jobs to businesses shuttering their doors, we are in an uncomfortable new normal. Even the area's largest employer, Walt Disney, announced just yesterday that they will be furloughing workers after April the 19th. So if the largest single site employer in America with 77,000 employees is going to furlough employees, it is going to have a significant impact on unemployment and the entire economy here within Central Florida. It's against this backdrop that I am announcing that we are suspending our pursuit of the 1 penny transportation infrastructure sales tax to be placed on the November 2020 ballot. Times are just too uncertain right now, so we are postponing our efforts. We will take up the transportation tax issue after the pandemic is over. Our focus for the time being will be on the health and welfare of our residents as we go through this pandemic. And as I conclude my remarks for now, I ask our citizens to continue embracing the strategy of social distancing, as it will save lives and reduce the spread of the virus. At this time, I'm going to ask Mayor Dyer to come forward. Mayor Dyer.
Thank you, Mayor Demings, and thank you all of Orlando. I'm really proud of the way that our residents are taking this public health crisis seriously and doing everything that they can to protect each other. And in the face of this uncertain time, our residents continue to respond with courage, with strength, and with hope. And we must continue this vigilance, continuing to stay at home, practice good hygiene, staying updated on the latest information on how you can fight the spread of the virus. When going out for essential items or exercise or fresh air, continue to do so responsibly, adhering to the CDC guidelines of physical distancing, keeping 6 feet apart. There's many ways to figure out how much 6 feet is, and I'm sure you can come up with an innovative one. Since we were here on Wednesday, we received notice that another member of our Orlando Fire Department has tested positive for COVID-19, bringing the total of firefighters to 2. Both were non-work related, and both have been self-isolating without any interaction with patients or other firefighters. As a city, we continue to work together with the local partners, Orange County, the state government, the federal government, to ensure that our first responders and essential employees will have what they need in the weeks ahead so they can safely serve the community and go home. Every day, our purchasing staff is working aggressively to pursue every opportunity to secure those supplies. And I want to especially thank our local businesses for being creative and helping us to retool their operations to provide some of these critical supplies. For instance, JLA Distillery, who is now making hand sanitizer, Teak Isle Manufacturing, who normally makes boat parts and is now constructing face shields. Also want to thank organizations that are donating supplies to the city at no cost. Just yesterday, we received 2,095 masks and 72 sanitation bucket kits from Home Depot Foundation and Operation Blessing. And I want to thank all of our city employees, both those that are on the front lines and behind the scenes that are keeping our city running, keeping our city safe, keeping essential city services for our residents going, everything from our solid waste and recycling collectors to permitting and code enforcement inspectors to our firefighters, emergency medical responders, and police officers. They're some of the heroes in this time as well, and I want to thank their families as they go out and do the work that they need to do. The quicker we can flatten this curve, as Mayor Demings said, and shut this virus down, the faster we can reopen our economy and get our businesses back on the path of recovery. Toward that end, yesterday, with the Orlando Economic Partnership, we hosted a digital workshop designed to help our local businesses utilize the CARES Federal Stimulus Act. Nearly 500 businesses and small business owners participated. That workshop and a COVID-19 resource center for Orlando employers are on the Orlando Economic Partnership website at orlando.org. Really good information. And I know that some of the benefits under the CARES Act have opened today, people making application for some of the loans that are available, and there have apparently been some challenges. And it's a big undertaking to roll out some of these programs in a short period. So we are hopeful that the federal government and our banking partners are able to resolve these challenges expeditiously. Helping our economy recover is going to take a great partnership between all levels of government. As we continue along this approach, we will advocate for our businesses and make sure that they are connected to the most up-to-date information on how to access any resources that are available to them. So right now, our shared efforts to stop the spread should remind us of how connected we are as a community, how intertwined we are. Right now, our health depends on your neighbor's actions, and your neighbor's health depends on your actions. So we need to continue to stay at home and protect every person in our community. Orlando, we are strong, and we'll get through this together. Dr. Martinez.
Good afternoon. Thank you, Mayor Dyer. On behalf of the Health Services Department at Orange County, I want to reiterate some of the messages that were brought by Mayor Demings and Mayor Dyer. And we want to remind the public that social distancing and hygiene are the two most effective ways to combat COVID-19. Everyone should be practicing social distancing as much as possible and washing their hands frequently if we want to defeat this virus and protect the most vulnerable in our community. And keep in mind that that very vulnerable person might be in your own home. It could be a child with a compromised immune system. It could be a parent. It could be a grandparent. So always keep that in mind. What are some examples of practicing social distancing at home? Maybe sitting a little farther apart at the dinner table, or while watching TV, or while sharing a story as a family. And what might be some examples of practicing more hygiene at home? Washing your hands frequently is an example. Sanitizing the doorknobs or frequently touched areas. And one thing that I think is important, and maybe we all don't think about it on a regular basis, is not sharing drinking or eating utensils. As a matter of fact, this might be the one time that we want to start practicing everybody in that household having an identified and unique utensil that they use themselves. And most importantly, as the mayors have mentioned, staying at home. That is very important. And the stay-at-home order is a systematic way of practicing social distancing from others to protect ourselves and the ones we love. It is not a vacation. It is not a holiday. It is a very extreme but necessary measure to save lives, and we all need to understand it that way. The second point that I wanted to mention is that we continue to remind the residents that unless you're experiencing life-threatening conditions like shortness of breath or chest pain, do not go to the emergency room. If you feel that you're having symptoms, light flu symptoms, please contact your primary care provider, your doctor, and he or she will give you guidance as to what should be the next step to take. Finally, and speaking of primary care providers, this might also be a good time to contact your doctor if you need to visit the doctor's office and find out if they have a way to see you other than physically at their office, for example, telehealth or by conference call. And actually, I did that with my mom yesterday. Rather than taking her to her regular doctor, we did a visit via the phone, and it worked perfectly well. It was the first time I've ever done something like that, but it was very, very pleasant. It was very easygoing, so something to do. So you might want to touch base with your doctor and find out if they have a way to do that. And also it might be a good time as well to contact your doctor to find out if their hours have changed or they have any different plans now with the COVID-19 situation. Again, social distancing, we know, and as the mayors have mentioned, is a very different way of doing our life right now. It's very abnormal, but it's the best way that we have so that we can get back to normal soon, and that's what we want. We want to get back to our normal lives as soon as possible. And with that, I'd like to introduce Dr. Pino from the Health Department.
Thank you, Dr. Martinez. I would like to give you some information with regard to the numbers, our curve, and some data from the CDC. Today, as the mayor mentioned, we have 589 cases, and probably by the end of the day, we will be over 600. And if we continue at this rate, probably before Friday, we could be, Friday next week, we could be at 1,000. So it is important that people understand that our curve, we will display at some point, is going this way. So it started very slow, and gradually, 2 weeks ago, basically we have one case. So it was smooth at the beginning, and then has taken off right now. It's basically vertical, meaning it's going up and up and up. And flatten the curve, like many may have heard in the news constantly, it means practicing those social distancing and prevention strategies to try to change the trajectory of that curve from vertical to horizontal as much so that we reduce the impact that the whole epidemic is going to have in the healthcare system and the number of people that will require care, especially elder people. So, of course, it's having an effect on an economy. But the effect that this can have in a health system and overwhelm the health system like we have seen in other parts of the country is even worse to the economy. So it is important, and it's in our control. It is really in our control to stop the spread of the virus. To a degree, it will happen, but we can diminish the degree to which that happened and bring that curve down for what is going. We continue to have a range from 0 to 91. The county have tested 6,000 people, and we have 81 hospitalizations, a little increase from the last time that we talked to you. And we also have 2 additional deaths. And this is also an indication also a reflection of that curve and the impact that it's having. The 2 additional deaths were in 2 females over 80 years old in assisted living facility and 1 who lived at home. They both died in clinical settings. The assisting facility is of high interest to us. You all read what happened in Washington State. We don't want that to repeat here. So the state and the county and us, we have taken several steps. I would like to report that all the tests that were conducted during the Sentinel study were negative. So that's an indication that at the time that we took that sample, there were not a wide spread of the virus within assisted living facilities that we tested. Not all of them. We test 5, and we test 10 individuals in each. But it's a good sample of what was going out there. Facility was also the facility where this person lived, the person that recently expired. And our condolences to their families, of course, and to everyone that is going through this difficult time. The state also instructed strike sites, which all living facilities and long-term care facilities in our county were visited to inspect infection control practices, and a plan was developed for each of them. And today in the morning, the facility where this person used to reside was also inspected by ACA and by the health department. Nothing wrong with the facility. This is not a reflection on the facility, but we want our precautions and take the necessary step to prevent and avoid anything like we have seen from happening in our county. And if we have to do more, we will do more. People are also asking, what is the path to recovery? How to recover if I was positive? And again, this is only for individuals who have had a positive test. Again, what I'm going to say next about coming out of isolation is only for individuals with a positive test result. Anyone is on isolation because they are suspected to be in contact with have to remain in isolation for the 14 days of the period. Most people develop symptoms by the 5th of the 7th day, but there have been some people who have developed later, and that's why the CDC added that extra week as a precaution there. So for people who have a positive test, to come out of isolation, all these conditions have to be met. First, it has to be at least 7 days from the day that you develop symptoms. You have to have at least 72 hours without any fever medication. It's just to be naturally no fever. And you also have to have a diminution of your symptoms. That means coughing, sneezing, shortness of breath. And there is another pathway, and that's with test. We normally will not use that one because we don't have that many test kits. But with test, you can have 2 tests within 24 hours that are negative when all those other conditions were met, meaning 7 days from symptoms and diminishing of your symptoms as well. We continue to provide our services at the health department, and our testing site continue to be operating. We are almost at 50 a day, which is the capacity that we anticipated. We'll continue to provide services as we get the resources that we need. Thank you. Chair.
Thank you. Thank you, Dr. Pino. Good afternoon. I did want to let the community know that we had another deputy test positive for the coronavirus, so that puts us at 2 deputy sheriffs who have tested positive. Both are in self-isolation at home, but I did want to let everyone know that we do have plans in place for this. We have plenty of law enforcement personnel to keep this community safe. And I'm pleased to say, for the most part, our residents and businesses are adhering to the stay-at-home order. I did want to reiterate, as the mayor said, our curfew is still in place every night from 11 p.m. to 5 a.m., and we will enforce that. And so we're asked every day at the Orange County Sheriff's Office, how many arrests we've home order. We have not had to make any arrests, but I do want to stress that's not what it's about. It's about people on their own adhering to the order. Nearly every day we're still responding to large gatherings or some businesses that have remained open that are not essential. And when we respond, those businesses are shutting down and complying with the orders. And some people are calling on businesses who essential, and so we just have to work through that and talk with the business owners. So I want to be extremely clear. If you comply with this stay-home order, we will save lives. If you do not comply with the stay-home order, more lives will be lost. And so by now, you've seen all the death projections, and even the best case are very concerning, and we hear about the numbers all the time. But remember, those numbers are names. and faces of people. So we don't want our mothers, our fathers, our grandmothers, and our grandfathers to pass because not enough people are staying at home. So we're pleading with you, adhere to the stay-at-home order, adhere to all the CDC guidelines so that we can save lives. If we do what's right, we could see more lives lost. So please comply with this order. Stay at home unless it's absolutely necessary to go to work if you're essential or to run an errand for the health and the health of your family and well-being. If you see violations in your neighborhoods or businesses, please call us. We will respond. We ask that you use our non-emergency number, and it's 407-843-4357. And of course, as always, if you see crimes in progress or see something suspicious, please dial 911. I guess the good news in all this, in the past 3 weeks, crime has significantly decreased in Orange County by about 30%, and our calls for service are down as well. So we do not want to have to make arrests for people violating the curfew or the stay-at-home order. We will to save lives. So we need to do everything we can together to keep our community safe, and we will all get through this together. So this time I'd like to introduce Dr. Barbara Jenkins, Superintendent.
Thank you, Sheriff. I think the best terminology is to say we continue to evolve. I remember Mayor, this is our new normal. So when it comes to our efforts to keep both students, employees, and communities safe, OCPS does have a plan, but I'd like to stress it will continue to evolve. So, and let me say as well, the board and I are very grateful to this entire community for so much support being offered to our 212,000 students. My prayer every day is that our youth will not be unduly traumatized by this pandemic. I want to encourage parents to use our website. It has lots of resources at ocps.net about how to talk with your children about COVID-19 and how to calm their fears. The governor's order ended the school closure through May 1st. Not a lot changed for the way OCPS is operating currently. It extends the period of time that we have a different mode of operation. School system feeding programs and school systems in general, as with the mayor's order, were exempted, but we will continue to endeavor to keep as many of our 25,000 employees working at home as possible and compensate those individuals who do need to come out to work sites to help us serve the needs of our children. I want to mention as well, we are looking to condense the actual number of days for those 9 a.m. to 2 p.m. operating hours. We will have more information about that early next week. 2 priorities we mentioned before, they have not changed. Number 1, we want to make sure we are feeding some of our children who would not get balanced without our school lunch program, breakfast and lunch being provided at our sites. And number 2, we want to continue some semblance of their educational program as they are at home with family members and parents. Let me give you just a couple of numbers. Our grab-and-go meal distribution, thanks to our employees and so many volunteers, 10 a.m. to 1 p.m., they are now at 52 different sites. We actually condensed a few of our sites, and then we've got a couple of non-school sites being provided for as well, thanks to partnership with John Rivers and Four Rivers organization. 597 of our employees working to make sure our students are served. 20,000 students per day, 2 meals each of those days computes at about 200,000 meals per week for our children. Beginning April 10th, feeding provisions to cover weekends for young people who would be at risk as well. We have waivers in place. Any parent who has students with disabilities does not need to bring their children to the feeding site in order to receive their meals. We're looking at further flexibility for our parents that may accommodate needs as well. We appreciate our partnership with Four Rivers, as I mentioned, and Second Harvest Food Bank. They are also providing family meals at our selected sites. So watch our website, ocps.net, to see when they are going to be in your area. Secondly, let me talk about distance learning. Thanks to our creative teachers and principals and assistant principals, we are up and running the first week completed in distance learning. And admittedly, some of the connectivity issues we had at the beginning of the week took some work, took some effort. I want to thank my central office team for troubleshooting some of those concerns. Numbers look like, though. Like at 7 a.m. in the morning, 4,300 students were logged on. By 9 a.m., 33,558 were logged on. And then by 10 a.m., 42,740 were logged on. So if you do the numbers, by the end of the day, 198,000 Launchpad logins were evident in our system. We are very pleased with those numbers. Also averaged about 300,000 assignments being turned in, submitted daily. Normally, you know, we have distance learning. Our middle school and high school students have been using it for some time. Normally, we'd have about 100,000 submission of assignments daily. We are up to 300,000 being submitted daily. And over 4,400 actual conferences, web conferences, where teachers are teaching live on our Canvas platform. Plans are underway to distribute additional laptops at the elementary school level for some families who do not have the connectivity nor the laptops, some of that thanks to our philanthropic efforts as well. I mentioned how grateful we are, the school board and I are, for so many community partners. Over $85,000, in fact, $85,855 have been donated for our children. Sponsored by Lockheed Martin, the Aaron Gordon Foundation, Addition Financial, and more. Funds are already being expended, gift cards for some of our homeless families so that they can get groceries and supplies at our local grocery stores. Purchasing hotspots for families who do not have the connectivity. Laptop is no good if you don't have internet connectivity. And then we're also receiving donations from KPMG, from Orlando Science Center, and more. Our situation, again, is fluid. We really appreciate those who want to help us. In fact, anyone who would like to help can just visit our website again and go to foundationforocps.org. Thanks to all of you for supporting our children. Thanks to our parents, our teachers, our administrators, to everyone for having patience as we K-12 education in a way that we have never conducted it before. And as we have that patience granted to us, we will continue to improve our services to our children. So thank you for that support. And now, Chief Judge Myers.
Thank you. Good afternoon. I want to thank you all for the effort that you make to disseminate information in the community. We have many people whose lives are impacted by the courthouse operations, and you're providing a tremendous service to them by communicating this information to them. I want to remind you that during this crisis, we continue to limit courthouse access to only proceedings that are essential and critical to the state of emergency or the public health emergency. The court continues to be committed to the health and the safety of all of our court users. Yesterday, Governor DeSantis entered an order staying all eviction and mortgage foreclosure proceedings. In response to that, today I issued an administrative order to our clerks of court in both Orange and Osceola County, suspending all actions related to mortgage foreclosure cases, canceling all pending mortgage foreclosure sales, and suspending all actions related to residential eviction cases. The order that the governor entered and that this court has entered is not to be construed as relieving individuals of their obligations to pay rent or mortgages. Those obligations are still owed. But all proceedings, all court proceedings in connection with mortgage foreclosures and residential evictions in Orange County have been suspended. We continue to operate the courthouse with limited access, but the courthouse is not closed. We continue to handle a good number of hearings remotely. I want to say this: please obey the stay-at-home order. The first option should always be stay at home. But there are some emergency circumstances where we recognize that it's essential to come to the courthouse. If you are seeking an emergency injunction for protection, you may come to the courthouse. If you're seeking an emergency shelter for children, you may come to the courthouse. Baker Act proceedings and emergency guardianship proceedings all continue to be conducted at the courthouse. We do so maintaining effective social distance and limiting the size of gatherings of live proceedings in the courthouse. If your proceeding was scheduled and canceled, you will be notified that it has been rescheduled. No proceeding will go forward without you and without your opportunity to be heard. Do not be concerned. If you are concerned, please contact the judge to whom the case is assigned through their judicial assistant. All of those telephone numbers are available on the courthouse's website, which is www.ninthcircuit.org. You can reach anybody through those methods. I've reminded you previously that jury trials are suspended through April 17. We fully expect that that will be continued. So if you've received a summons through April 17, you need not appear for jury duty. You are excused, and it will be another year before you're summoned. Continue, please, to follow us on our courthouse website, where you can gain additional information and ask questions. Additionally, if you want the most current information, please follow us on Twitter or Facebook at Ninth Circuit FL. Thank you, Mayor.
Thank you, Judge. Before I open it up to all of you for questions, I have a question as a grandfather with 4 grandchildren in the Orange County Public School System, Superintendent. If a student, can a student be disciplined for skipping school if they're at home and they don't sign in on their iPads? No. Okay, I'll open it up for questions. Apparently, she talked to my grandchildren in advance before she answered that question. All right, any questions that you have? Okay.
Lauren Seabrook, Channel 9. This question is actually for Dr. Pino.
Okay, and so as Dr. Pino comes up, if multiple individuals have questions for any of the speakers who will come to the mic, please let's just ask them while that person is up at the mic. Dr. Pino?
Hello.
Yes.
Do you have any information on the positive cases that are coming out of the drive-through site at the convention center?
We get the results. Is that what you mean?
Yeah, can you tell us how many positive cases have come out of that site so far?
I don't have the number with regard to the number of tests, but our positive rates remain around 10%.
That site?
For the entire county. Any test. Yes.
Dr. Pino, Ryan Gillespie at the Orlando Sentinel, kind of to that same point with the drive-in site. What is being done, if anything, with it hit capacity at like 9:15 this morning? Is there anything else that can be done there to leave that site open longer?
So I believe the county, we are in conversation with the emergency department at the county to see what can be done, either to increase or to take over the site after the federal government leave on April 10. But there is some cost associated with it. And the number of tests, it have to do with the chain of supply, but also with the ability of labs to handle the volume, which is also important not to overrun the labs with unnecessary tests and prioritize when needed.
With Channel 2, the case in the assisted living facility, are you able to tell us which assisted living facility?
No.
Okay. You expressed concern, the Washington State situation. Put us at ease or tell us how bad it could get, I guess is what I'm trying to figure out.
So at ease, we don't have any situation in any of the assisted living facilities in our county at this point today. Because we learned from Washington State, the nation learned from what happened there. More than 20 people died in a very short period of time. So it's critical that we keep this virus away from assisted living facilities. These are very vulnerable populations, mostly over 65, with pre-existing conditions. And so it's critical to keep this virus away from those places.
Danielle Lama with Fox 35. Are you concerned that the convention center site is hitting capacity so early? What does that show about the demand for testing and the supply? And are you all working at all to try and set up more testing sites throughout Orange County?
So not concerned, because that was the projection, that was the intention from the beginning. They calculated what the volume would be. Of course, a demand exists, and there are some level of anxiety in the population in general. But also at some point, testing for the general population, although what I'm going to say is very unpopular, it may not be reasonable. Because at some point, the result of the test where you have this pandemic environment may not be significant for the community at large. It may be very significant for assisted living facilities. It may be very significant for a hospital where the test will indicate what direction the treatment will take. But for us, what is significant for the general population is to stay home. That's the best way to prevent this. And a negative test today doesn't mean much in the sense that you can get it tomorrow if you don't take the measures that you need to take.
Dr. Pino, Steve Hudak from the Orlando Sentinel. I'm wearing a mask today, because I've been sneezing.
You look great.
Thank you very much. A couple of things. First of all, we did that Sentinel testing, where we did the testing at assisted living facilities. Have we received any results from that? What did those show us?
They were all negative.
They were all negative.
They were all negative, and what it shows is, remember, this is just a cross-sectional. So it only reflect what was done at that time, not before or after, just that time. At that time, we didn't have a widespread of the virus in those assisted living facilities that were tested. That's the meaning of it.
Hey guys, this question.
So, la recomendación para cualquier persona, si te sientes que te está dando la gripa y lo que te sientes es mal, te duele el cuerpo, te da un poquito de fiebre, pero no tienes falta de aire, no tienes dolor en el pecho y no estás en peligro de tu vida, es lo mismo que para este virus no hay medicina. Se están tratando cosas aquí y allá, pero no hay medicina. Entonces lo mismo, es el Tylenol, es mantenerse hidratado, es descansar y escuchar al cuerpo y tomar alimentos que son nutritivos. Por lo general, estar en casa. In Spanish or English? English. Okay. We have heard that question over and over. People want to know how many people have recovered. And that's a hard question to answer from the data. What is safe to assume, I say safe to assume, and sometimes with data you have to make assumptions. What is safe to assume is that anyone that acquired the virus more than 14 days ago will have recovered. And you take away the number of deaths that you have, and you subtract the number of people that are after those 14 days, and you have what is called prevalence. How many people right now have the disease in the county? But it could be very misleading to offer that number. So what we offer is total number of people who so far has acquired that disease that we know. And those are the conditions of the data. Thank you.
Dr. Pino, we spoke with some people who live in some of the hot zones, and they were a little concerned after learning they live in a hot zone. What do you want people who live in those areas to do with that information?
The same of people who are not living in the hot areas. Is to keep yourself away, to keep distance, to have hygiene, to restrict your movement, and to keep yourself at home as much as you can in the family unit.
I have a question for Chief Mina.
All right, Chief, Sheriff Mina. Sheriff Mina.
Sheriff, Chief, whoever's in charge.
Okay, so same rules apply. If you have multiple people have questions of Sheriff Mina, ask him all while he's here at the microphone.
Thank you, Mayor.
Sheriff, you indicated that so far you haven't arrested anybody, but you would be willing to. Even in an emergency, people still have certain rights. So I'm wondering whether it is they're going to be going to church or because they just believe, hey, I don't have any illness, I shouldn't be restricted. What are you directing your sheriffs how to speak with people in that way?
So obviously, anyone going to any kind of religious function would be exempt based on the governor's order. But before our deputies are taking any actions, and this goes for all of Central Florida law enforcement, before they're taking any action, they're contacting a supervisor or talking to their legal department. And that's why there haven't been any arrests right now. So we're just working through that. And like I said, that's the last thing we want to do. But we do want people to adhere to the order.
Sharon Stone with News 13. I think this is a question for you, Sheriff Mina, perhaps not. I'm asking on behalf of a colleague who's at a similar press conference in Seminole. They announced that they're having people who test positive still running errands, doing grocery shopping, and they have 5 people they've identified doing it, and he would like to know if there's any evidence of that happening in Orange County as well, people testing positive and still going out, not self-isolating.
We're not aware of any cases like that. Obviously we want everyone to stay home. And, just like Dr. Pino said, certainly if you have tested positive, your primary physician and the CDC.
Sheriff, when you spoke to us, you sound frustrated. You say, if you don't stay home, lives will be lost. Are you frustrated?
Yeah, I think everyone's frustrated when you see the amount of people that are still out and about. It's evident that not everyone is complying with the stay-home order, and I know it's tough. It's uncomfortable, as the mayor has said many times, but we need to be uncomfortable to save lives. And I'm showing my frustration because I want people to really adhere to that. It's easy to look at those numbers on the TV, but those are real lives and real people that we're talking about. And the experts have said, you've heard it up here, you've heard it on our national news, that if you stay at home, we will save lives.
This is for Mayor Demings. Lauren Seabrook with Channel 9 again. I understand when Dr. Pino says that at some point the testing doesn't matter. But when we're talking about dollars, supplies, we do need to know how many cases we have in this area. Are you concerned that we don't have enough testing to be able to get the supplies and the tests that we need? And we're hearing a lot about South Florida getting more tests because they have higher numbers. So again, are we competing with South Florida to get this?
I'm concerned about it from the perspective that this pandemic has created a lot of anxiety within our community and really across the globe. And so one thing that the test can do for an individual is provide some feedback to them about whether they're ill or not. And sometimes if you don't have the ability to take a test, then you continue to anguish over that. So I think for the overall mental health of our community, the testing is but one way that we're able to reassure the community that they're not sick, or if they're sick, that there's help for them, or it reassures the community about we're recovering. At some point, hopefully, even though we're seeing this significant spike in terms of the numbers of positive tests, at some point we want to see that number come down. And once we see that, then we are able to, I think, fully begin to recover as a society, and our commerce can return to what we all want it to be, and we can resume some sense of normalcy at that point. So from that perspective, I think the testing does provide a benefit to the community. In terms of the dollars, I'm not quite sure. Okay. We have received about 14% of the mission requests that we have submitted to the state. I was on a conference call this afternoon with the mayors or county chairpersons from the major counties, the largest counties in Florida. And that was something consistent on that phone call that I heard, that none of us are getting the high percentage of the mission requests that we're submitting to the state. That includes requests for personal protective equipment, for hand sanitizers, to collection kits, to testing kits, et cetera. None of us are receiving what we really need at this time. although there's hope there, the state readily tells us that, there's something in the pipeline, but there's truly been a lag between the point that we have the need, we identify the need, and when we're receiving the equipment or supplies.
Okay. Mayor Demings, Brian Gillespie at the Orlando Sentinel. Not sure if this is best for you or Dr. Pino or both of you, but as you guys have looked at this heat map this week, I know the numbers have changed, but are there any trends kind of built in there that you guys have picked out that people should be aware of? Are there neighborhoods specifically in there that are concerning, anything like that?
What I would tell you about a heat map is it's very difficult to be able to analyze what you're looking at on a day-by-day basis. Those trends take probably days or a week to be able to really discern any type of reaction or response to what we're seeing. However, I will tell you that also today we had this conference call that I alluded to in my comments at the beginning with the CEOs and other healthcare experts from our largest hospitals here within the region. They are perfecting the data analytics to be able to take our very unique experience here in Orange County and then extrapolate that out to be able to tell us when we may peak, when we will see the surge, and perhaps from all of that data, we're able to have an appropriate healthcare response to this healthcare crisis, if that makes sense to you. Okay. Other questions?
One more. Louis Bolden, WKMG. Mayor, looking at the state's dashboard today for hospital beds, it appears that 60% of the adult ICU beds in Central Florida are currently occupied as we head towards the peak. Should the community be concerned about that? And can you tell us specifically, after your talks with the heads of our hospital systems, how they are preparing for the peak?
Okay, what the hospital executive said to me today was that the projections that can be used by which to make some decisions upon using a certain model, they hope to have that model or models more precise by mid-week next week so that we can use that information by which to draw some conclusions. What they also said to me was that in terms of the capacity of their existing hospitals and available beds, they have capacity. Their concern will be a week from now, 2 weeks from now, 3 weeks from now, what that demand will be and whether they'll have capacity. Just like every other metropolitan community around America that has preceded us in terms of dealing with the virus, who may have already peaked, many of them had a shortage of ventilators and other pieces of equipment. And so what we're trying to do is trying to understand the peak periods of time and match that with available resources, available beds, available ventilators, and work to fill the gap before we need it. That response is a collective response that will transcend counties, more of a regional kind of a response, and which is why we have committed within this region. Today I had conversations with the county chairs from the neighboring counties to say we must look at somewhat how we have responded to this healthcare crisis at this point more cohesively and partnership throughout the counties, irrespective of jurisdictional boundaries, but more in terms of the hospital capacity and how we will respond. So we are putting plans in place for to hopefully get in the pipeline to have enough ventilators, worst case scenario, if need be, to have alternative locations where individuals can be housed if they are medium risk and not high risk. If they're high risk patients related to COVID, maybe they should be in the hospital. If they're low risk and they have other illnesses Maybe we need a MASH type unit here within the region that we will divert people to. And then if people are low risk or they have minor symptoms from the COVID virus, maybe they stay at home and we create a system whereby there could be some care advocates who would go into the community, monitor those individuals, provide those households with personal protective equipment so that they don't spread it amongst themselves. And so that's the kind of thinking and thought processes that we're going through now. And so hopefully, as we get more data by mid next week, it will allow us to react more specifically to our own experience here in the region. Okay.
Mayor, this one's coming from Ryan Lynch with the Orlando Business Journal. He goes, this has to do with the transportation initiative. He goes, do we have a timetable for the potential return of the tax, or is it more indefinite? Wasn't sure if there was a goal to put this on the November 2021 ballot.
Okay, so he's referring to the transportation surtax penny tax that I've been working on for the last year. What we're saying now, because of some deadlines associated with being able to put the potential for that tax on the ballot by November, given this pandemic environment that we're in, we're not going to be able to meet the current deadlines required statutorily by the state of Florida. And now the law is that you can only advance such an initiative to the ballot during a general election. The next general election cycle will not occur for 2 years. That's 2022 under the current law. There's a possibility, who knows, that the next Florida legislative session, the legislature could change that and allow it to advance during an off period of time. But I continue to believe that we have to have some other solutions to our transportation challenges going forward. None of us have a crystal ball. We couldn't have predicted that we would have a pandemic that is going to, it appears, last for several months, and the economic impact from that could be even longer. Putting the period of time that we would be asking our residents to vote for this on the ballot in November will be a period of time of uncertainty for many of them in terms of their own economic well-being, and I think that may not be the best period of time to have success in having the sales tax initiative pass if it were advanced to the ballot. So my commitment is to look at that in the future for a more appropriate period of time to take it to the ballot. Okay. Thank you all again for being here this afternoon.